hub for topical discussions around health and wellness. I'm Queen Agaba, and today we are looking at one of the most pressing mental health issues of our time, anxiety disorders. Joining me on the program is a renowned psychiatrist, Dr. Chukwudi Charles Elonu, who is a consultant psychiatrist at Zalia Services, Kado Abuja, to share his insights, his expertise and experiences in diagnosing and also treating and managing anxiety disorders. From research to therapeutic approaches and practical advice, he will provide a comprehensive understanding of what anxiety disorder really means and also offer hope to those who are affected. Many thanks for joining me on the program, Dr. Chukwudi.
Thank you for having me, Queen.
It's a pleasure. Can you, talk to us about some of the most common disorders you have encountered in your practice?
Well, thank you, Queen. Well, I would say that anxiety disorder is one of the most common mental health disorder. And this is usually not understood by a lot of people. A lot of people think that when you talk about mental health or psychiatric illnesses, they start thinking of what they call madness. We don't call it madness, actually, but that's the street name. So once they hear about psychiatry, they start thinking of madness, but not knowing that even those people who think that mental illness is all about madness also have a mental illness, which is actually anxiety disorder. Some of them have depressive disorders, and so on. So if you ask me, I would say that anxiety disorder and depression are actually very common, and I have encountered them most times in my practice.
Okay, can you talk to us about these symptoms? How do you, what are the symptoms you see before diagnosing a person of anxiety disorder?
Well, let me start by saying that anxiety disorder affects almost all your body, actually, but there are criteria for diagnosing anxiety disorders. But before then, we have to know that there are various kinds of anxiety disorders. We have the one we call generalized anxiety disorders. We have one we call panic disorder, and a lot of other anxiety disorders. But let me stand on talking about generalized anxiety disorder. They actually have common symptoms, but there are differences, actually. But then, for me to diagnose anxiety disorder, usually there are a constellation of symptoms that the individual have. Let me start by the most common ones. Let's start with sleep. A lot of people complain about sleep. In mental illness generally, people complain about sleep, having sleep difficulties. Some people have difficulties initiating sleep. Some have difficulties maintaining sleep. And others have both. So sleep problem, especially difficulty initiating sleep, is very, very common among people that have anxiety disorders. There are other symptoms. People who have anxiety disorder think that they have heart problem. Because what they notice is that their heart will start beating fast. They have what we call palpitation, increased heart rate. Aside from that, they also have problem with their breathing. Not that they have primary breathing problem, but because of the anxiety, it mimics a breathing problem. So their breathing begins to change, begins to become somehow unsteady. Now, there are also others. They may also have chest pain. They have chest pain as if they are having some heart issues. So most of them think that they have heart issues. Now, for this psychological aspect also, one of the commonest things is fearfulness. People that have anxiety problems, they have fearfulness. They do not understand why they are so fearful. But they have noticed that there is this persistent fearfulness and also worry. As human beings, as individuals, we usually worry about day-to-day activities. But people who have anxiety as a disorder, they have undue, what we call is like almost baseless. They have this worry about everyday activities. They worry about everything. So there is worry, there is chest pain, sleep problems, and then also very important is that some of them may have what we call tremors. Their body begins to shake. Sometimes you as an individual may not notice it on them, but they themselves know that they are actually shaking. So the shaking may be visible, it may also be invisible to other people. So they notice that this tremulousness that they feel. They also have fatigue. They feel that they have low energy. They don't have energy to carry out their day-to-day activities. So it makes them unable to function. to go through their day-to-day activities very well. They may also have sweating. So these are some of the symptoms that we see in people who have anxiety problems. They also have hypervigilance. Hypervigilance means that as if they are on guard all the time. They are very vigilant. They easily get startled. When you drop something that sounds so loud, they easily get startled. They shake. So these are some of the things that we see among people who have anxiety problems. There are a lot of other symptoms, actually.
Okay, so all of these symptoms you just mentioned, I assume they fall under the generalized anxiety disorder.
No, every form of anxiety will have a lot of these symptoms I have mentioned. But for you to call it a generalized anxiety disorder, there is a criteria.
Okay,
now, people that have general anxiety disorder, they have these symptoms almost every day. They can have it up to 5 days in a week. All
of these symptoms or a particular symptom?
Okay, let's say a constellation of these symptoms, they may have 5. Please note that one individual may not have all the symptoms of anxiety disorder. If you have anxiety problem, I have anxiety problem. Some of your symptoms may differ from the one I have, but there are common ones. Fearfulness or being worrisome is there. Some palpitations will also be there. So there are common symptoms, there are some uncommon symptoms, but we may not have identical symptoms. So for you to diagnose generalized anxiety disorder, one, you must have been having these symptoms for some time, usually a period of 6 months. That's one of the criteria.
Okay, Dr. Chukwudi, before we talk about the diagnosis, can we talk about what causes, these anxiety symptoms? Can we talk about the causes? How?
Just like in other mental health problems, you cannot hold on to one particular thing as the cause of anxiety disorder. We also see that in people who have psychosis and other form of mental illness. Unlike in physical conditions, let's say malaria, for example, at least we know the cause. We can pinpoint it. The cause is usually malaria, it's usually from mosquito bite. Okay, Plasmodium is transmitted and all that. But in anxiety disorder, there are a lot of factors that can make somebody to have anxiety disorder. Now, one of the most important one is genetic factor, meaning that some people have this genetic susceptibility to have anxiety problems. If you have a mother or a father who has had an anxiety problem, you are more likely to have it than somebody who does not have a parent who had anxiety issues. Not that people who don't have parents that had it will not have anxiety problem, but you are more likely to have when you have both parents or even a single parent who had an anxiety. So there is a genetic factor there. Now, other important things apart from genetics is life events. If you are under stress, for example, especially chronic stress, prolonged stress, it may be marital stress, it may be financial stress, it may be due to illness or anything that puts you under pressure constantly for a long time. That stress can culminate into somebody who starts having anxiety problems. Your heart begins to beat faster, you begin to sweat unnecessarily, and other symptoms that I have mentioned. It is also important to note at this time that there are some physical health conditions that may mimic anxiety problems. And this is very important because when your heart begins to beat faster, you begin to sweat, you begin to feel tremor. As clinicians, we don't just focus on primary anxiety problems. We want to know, is this individual having a medical condition? A lot of medical conditions can actually mimic that. And it's good to rule them out before we can say, this individual has primary mental health condition, has primary anxiety problems. One of it, and one of the most important, is thyroid problem. People that have thyroid. When you have excessive production of the thyroid hormone, it begins to mimic symptoms of anxiety. Your heart will beat faster, you will sweat, you will not be able to sleep, you become hypervigilant. Most of those symptoms I've mentioned in anxiety, you will see it in these individuals. So if a doctor is not careful and you go and diagnose the individual with anxiety problem, neglecting the physical aspect of it, you may end up losing that individual. Aside from thyroid, people who have diabetes may also have these symptoms. Okay, people who have other hormonal imbalances may also have these symptoms. So as doctors, as clinicians, one of the first things we do is to try to rule out all these other physical conditions that may mimic anxiety. When we are able to rule them out and say, oh, this individual's thyroid is okay, he doesn't have diabetes, he doesn't have all these other problems, now it's likely that this individual has a primary anxiety problem, and he has had it for up to 6 months or more. If it's a generalized anxiety disorder, we treat as such.
Okay, so moving to the diagnosis now. Talk to us about how you diagnose these disorders.
Yes, diagnosis is all about looking at the symptoms. The important thing is we talk with the patient. In mental health generally, even though we do investigations, we do tests, but to make our diagnosis is basically from interacting with the individual. And that is why whenever you meet a psychiatrist or a behavioral physician, we take a lot of time to interact with our patients. While other people may spend 10 minutes, 20 minutes seeing a doctor, for you to see a psychiatrist, we spend up to an hour discussing your issue. So it's from that discussion, from the symptoms and signs that we have been able to gather, we take you back even from childhood. We ask you questions about childhood. We even start from birth. If the patient's mother is there, we ask from birth. We ask from when the child was a year, 2 years, was there any problem? Was the child abused? So we ask questions from that time up until present. So this helps us to make a diagnosis of various mental health problems in each of the patients that we see. So for anxiety symptoms, for anxiety disorder, we ask questions about anxiety symptoms. We're able to find out the duration, how long has it been happening, then the severity of the illness. People have anxiety. We have anxiety for several reasons. Somebody who has an exam tomorrow will have anxiety, will be anxious today. Somebody who is expecting a contract will be anxious today. But at least we understand the basis for these anxieties. But when there is no particular basis that you can hold on to, that look at the cause or look at the reason why I am fidgeting, look at the reason why I am fearful, and it has lasted for up to 6 months, then with other symptoms we'll look at, with other criteria, we say, this individual has an anxiety problem. The individual must also not be able to function. You will be so anxious that you're not able to carry out your day-to-day activity. If you're a student, you're not able to study again. You're not able to go to school. If you are a worker, if you are a staff of any company, you will not be able to go to work. So it affects your functioning. When it begins to affect your function, it becomes a disorder. And with that, putting everything together, we're able to make that diagnosis. And usually very clear when we make such diagnosis in individuals.
You know, with some of the symptoms that you have mentioned,
Yes.
how individuals are unable to function as they would ordinarily, is there a way we can link anxiety disorder to depression, or are there other underlying issues that comes as a result of untreated or undiagnosed disorder?
Well, of course, anxiety, most times they coexist with depression. Some of these mental health conditions, they intertwine with each other. But usually we make a diagnosis based on the one that is more prominent and the one that causes most disability in the individual. Now, most people that have anxiety problems have some tinge of depressive problems, and vice versa. People who have depression also have some tinge of anxiety symptoms. But sometimes they can also occur, both of them may have the same weight in an individual. Okay. So sometimes diagnose a mixed anxiety and depression. So there are some just depression, some just anxiety. But just know that somebody who has anxiety can have depression also. But anxiety will usually be more prominent in such individual. Now, when anxiety is allowed to last for a very long time, if it is untreated, well, sometimes the individual does not die because it's a psychological illness. The individual may not die, but I can tell you that the individual most times will wish he is dead than to live. Why? It is because it causes serious disability in the individual. It makes the individual very uncomfortable. They are so uncomfortable that they start wishing that they are dead. Because I've had a patient who told me, "Doctor, what am I living for if I can continue to live my life being very fearful on a daily basis, worrying about everything, having my heart to beat as if I'm running a marathon, and so on daily basis?" So at the end of the day, the individual may not die, but the quality of life of the individual will be highly impaired. So they will wish they were dead.
Interesting conversation right
Yes.
here. But we have to take a quick break. When we come back, Dr. Chukwudi will talk to us about treatment and the way forward, discussing anxiety disorder. Please stay with us. We'll be right back. Many thanks for staying with us. If you've just joined us, this is Health Guide on Global Television, your hub for topical discussions around health and well-being. And on the program, we have Dr. Chukwudi Elonu, who is a psychiatrist and consultant, helping us make better sense of anxiety disorders and talking to us about the symptoms and treatment. Dr. Chukwudi, thank you for joining us once again.
Thank you.
Behind camera, I was just asking you a question about someone who has a background of anxiety disorder. How can this person manage, knowing that, they are prone to having this disorder, or already seeing symptoms of this disorder? How can they manage this disorder without having to visit, a clinic or visit a psychiatrist?
Okay. Let me start by saying that for the fact that somebody has a background, I know you are trying to talk about hereditary factors. Maybe the parents had it. For the fact that someone's parent had it doesn't necessarily mean that the individual will have it. Now, but it is good to know that if your parents had it, it is more likely, you have more chances of having it compared to someone else who does not have parents that had anxiety problems. That's the main thing. Now, if you know that your parents had anxiety problems and you are more likely to have an anxiety problem, I think lifestyle adjustment is very important. You cannot do anything about the genetics. You already have the genetic predisposition. So if you know you have that, I think there is need, especially as an adolescent, as an adult, to reduce stress. There are certain things you need to do to reduce stress. If you know what is stressful to you, you avoid it. If your job is causing severe stress for you, probably you may have to reconsider that job. If you are taking substances, for example, people that use drugs, sometimes the way it works is that when they start using that drug, it tends to calm their anxiety. And they say, oh, wow, if I take this drug, it calms my nerves. Oh, that's fine. I've gotten something that helps me. But it is actually counterproductive. When you continue to take that drug, you now notice that over time, that particular drug that was helping you previously has become a huge problem for you, has become a huge source of the anxiety you are trying to run away from. So it's counterproductive. So using drug is a no-no completely for everybody, especially if you know you have a genetic predisposition to any form of mental illness, be it anxiety, depression, psychosis, or anyone. Now, going to your question about managing it without seeing a psychiatrist, I was just wondering why not seeing a psychiatrist, why that? But however, yes, as in mental health discipline, we don't just have a psychiatrist there. Psychiatrists work very closely with psychologists. We work with social workers, nurses, and it's a multidisciplinary team. You don't just see a psychiatrist and go away. There is need to see a psychologist, So to answer your question, yes, if we have to first of all look at the severity of the anxiety, if it meets that criteria that you need medication, because we use a talking therapy, we use medications. Now, a psychiatrist, it is his duty to prescribe medications, also do talking therapy. But the psychologists also, they do talking therapy. So if the severity of the anxiety problem is low, we consider it mild, well, we just refer, go and see a psychologist. The psychologist will do a talking therapy. We do have various forms of talking therapy depending on the diagnosis that we have made. So for anxiety problem, they have various kinds of talking therapy. We can do what we call cognitive behavioral therapy. That's one of the main ones that we do. Anyway, the explanation is for another day. Yeah. So you call it cognitive behavioral therapy. The other therapies that we can do for them without necessarily have to give them medications, drugs. But if we think that it's very severe form of anxiety, talking therapy alone may not work, really. So you need a combination of the talking therapy as well as the medication. We call it pharmacotherapy. So when both of them are applied on a patient, the patient has more chances of recovery compared to those who had only talking therapy. So, but if you don't want to see a psychiatrist, well, that's fine. If you have mild anxiety problems, you just see a psychologist. Social worker will also be there, depending on what we have found. Sometimes we notice that individuals may be having severe anxiety as a result of social problems. If a woman is going through a divorce or going through marital abuse, for example, and these are the main sources of her anxiety problem, no matter the drug that the psychiatrist prescribes, the patient may never get well. So it is the duty of the social worker at this point to delve in, to find out what's going on. If it requires a family couple therapy, then we refer to a psychologist, they do a couple therapy. If there's so much abuse that the husband has to be stopped by all means, the social workers are there to help the woman, or even to help the man in some cases, because some abuse is not just about man against a woman, it's also about a woman against a man. So a social worker is also there. So there are a lot of therapies we do, a lot of ways to manage this. A doctor is there, that's the psychiatrist. The psychologist is there, the social worker is there. The nurses are there also. So we work in tandem with each other. We work in unison as a team to manage our patients.
Okay, talk to us about treatment quickly. This is the conversation, I wish we were not bound by time, but we'd definitely love to have you again on the program. But talk to us quickly about, treatment outside of, you just talked about therapy. You can talk to us about treatment. Are there possible treatments maybe peculiar to the kinds of anxiety that people have and,
Yes. Okay. Treatment. Well, when it comes to management, it also is treatment. You're talking about treatment. Now, I guess you're talking about maybe medicine, drug treatment.
Drugs,
yes.
Exactly.
Well, yes, we, as doctors, we have several medications we use to treat anxiety problems. There are various groups of medications we use, but just to summarize all of them, we call them antidepressants. Okay. These antidepressant drugs are also anti-anxiety drugs. There are other drugs that are specifically for anxiety. Some are better for anxiety than depression, while some are better for depression and anxiety. But basically, we use the same drug to manage the two. But maybe some small differences, maybe in the dosing or maybe in the duration. So for drug treatment, we have various kinds of drugs. We have the drug we call SSRIs. Selective serotonin reuptake inhibitors. These are a group of drugs that help to normalize some chemicals in the brain. And lest I forget, people who have anxiety problems, the question is, what is the biological reason why they are having anxiety? There is a reason for that. Usually, there are some brain chemicals, some neurotransmitters, called them neurotransmitters. There are brain chemicals in the brain that have gone out of balance. And the question, what makes them to go out of balance? Genetic factor I've mentioned. Chronic stress can make them to shift. If you are subjected to a long-term stress, chemicals begin to change. You may begin to notice a change in your stress hormone. We call it cortisol. And these hormones have relationships with each other. When cortisol increases, it will invite others to also increase, while inviting other ones to decrease. So the stress hormone is called cortisol. When you go through a stress, no matter the form of stress, it may be marital or any other form of stress, your cortisol level begins to increase. And when it increases, it invites others like adrenaline, noradrenaline. They will start increasing, making your heart to begin to beat faster. Now, there are other hormones that quietens you, that makes you to calm down, calm down. Those ones that makes you to calm down will begin to decrease, which should not be so. A hormone we call GABA, for example, gamma aminobutyric acid. That's the name of the hormone. So it makes you to calm down. So when GABA begins to go down and adrenaline begins to go up, it puts you in a very bad state. You become hyperactive. Somebody that is running on a field will even be better, almost be better than you, because your heart will begin to pump faster. Even when you are resting, you cannot really rest. You become so nervous. So because of these chemical imbalances in the brain, we begin to have anxiety problems. So these drugs we give target those chemicals to put them to check, to balance them, so that you begin to calm. That's what these drugs do. So for the drugs, we have SSRIs. We also have the one called TCAs. We call them tricyclic antidepressants, and other ones that we use to treat anxiety problems.
Okay, that's how much we can take on the program, Dr. Chukwudi. Thank you so much for helping us, sharing your insights on this topic.
Thank you for having me.
Thank you very much. Dr. Chukwudi Charles Elonu is a consultant psychiatrist at Zalia Services, Kado, Abuja. Well, many thanks for joining us on the program Health Guide today. Don't forget to follow us across all social media platforms using @Global TV NG and other handles now showing on your screen. You can also download the Global TV Nigeria mobile app for Android and iOS devices to keep track of our broadcast. Many thanks for watching and see you again. Bye for now.
Bye.